Hi guys, so we are continuing with our long bone fracture tutorial that we started yesterday. Long bone fractures. So please, before you come and watch this, because this is part 2, so before you come and watch part 2, please watch part 1 first so that we can be on the same page. So we said that we are going to try and describe our fractures according to, because whenever you are calling someone to present to them, or you are presenting, or maybe okay guys, you need to, as students, to the students, you need to practice describing fractures. So whenever you're on call or you are doing orthopedics, try and get x-rays, old x-rays, and try to describe them according to what I'm going to show you now. Use this method so that you can get into the habit of describing fractures. Obviously, the more you do it, the better you will become at it. So that's the only way I learned how to describe fractures. That's the only way. So we spoke about the fracture that we spoke about. We said that the first thing that we need to do is to tell which limb it is, which bone is involved, the location, and we said the location, you divide the long bones into 3 thirds, and then you speak about displacement. So we said the fractures that are very common to transverse fracture, spiral fractures, oblique fractures, and you can have combination of these two where it's a spiral oblique. Oblique fractures and spiral fractures, their mechanism of injury is usually twisting. And then we have maybe I should have just listed them on one side. So transverse fracture, let's start with hairline fracture. A hairline fracture is so minimal, guys. It's so minimal. It looks like a hairline. It's like minimal trauma that is involved there. Some people even call them stress fractures. And then we have a transverse fracture. We have an oblique fracture, we have a spiral, or we have spiral oblique, we have segmented, we have, these are the most common ones. We've got butterfly, we have a comminuted fracture, meaning multiple pieces involved. And remember, all fractures can either be open or closed. That thing of simple fracture or compound fracture, it's all terminology. They speak about open or closed now. An open fracture is a fracture whereby there is damage to the skin. So the skin is not intact. And the damage to the skin overlying a fracture can either be due to the direct trauma, or it can be because of the bone, the fragments of the bone that is pierced through the skin. Doesn't really matter. A closed fracture, the skin is intact. And if it's an open fracture, now we are going to talk about Castillo-Anderson classification sometime. Castillo-Anderson, because they will ask you about it. Castillo-Anderson classifies open fractures. Okay, comminuted fracture, butterfly, green stick, if you can pay attention to the fact that I have not mentioned any, specific fractures here. I haven't spoken about Colles. I haven't spoken about Smith fracture. I haven't spoken about what is this other fracture now? I've forgotten it now. So I haven't, because those fractures, those specific fractures, are coming from one of these, but it's just someone who described the fracture. And like I always say, a well-described fracture, it means it has got a specific mechanism of injury. It has got a specific way of presenting, a specific way of managing it. Once they say Colles, like I once explained that once someone says I've got a Colles fracture, basically they are saying I've got a fracture of the wrist, the distal radius, and this fracture, it's someone who's old, who's got weak bones, an osteoporotic bone. That's why I said you cannot get a Colles fracture from someone who's young. So by you saying it's a Colles, it means you're saying that person has got weak bones. It's someone who's probably old and yeah, I'm not sure if I'm forgetting any type of a fracture right now, but these are the most common ones. And we said that with a butterfly fracture, it's a fracture like this, segmented. There's a fracture here, there's a fracture here, oblique, spiral fracture, spiral oblique. I said I struggle to draw spiral oblique, but oblique is like this, and then spiral would be like this. This would be spiral, so spiral would be like that. It's difficult to draw it, but it sort of like goes around. That's a spiral fracture. It goes around the circumference of the bone. And we spoke about transverse. Okay, so I want us now to try and learn how to describe fractures, and we're gonna follow this as we describe our fractures. Let's say now I have this bone. I believe this bone is a femur of the left. So what I'm gonna do, I know that the first thing is that this is the left femur, first of all. So when you try to describe a fracture, even during an OSCE or a consultant is asking you, don't jump into describing the fracture first. First, obviously look at the name of the patient, when the X-ray was done, and all of that. And then now say which limb it is. And sometimes you don't need to first check the X-ray marking if it's a left or a right. You can just see the anatomy of the bone and say, okay, now this is the left, whatever, or the right, whatever limb. So this is the left femur. Now what I'm gonna do is I'm gonna divide my femur into three into 3/3. This, like I said, is the proximal third. This is the middle third, and this is the distal third. So now my fracture is here. This is my fracture. So how will I describe this fracture? I'll say, doc, I've got a fracture, I've got a butterfly fracture that is located in the middle third in the left femur. It doesn't matter how you organize it, as long as you have all the information that is needed. Or you can say, I've got a butterfly fracture of the left femur that is in the distal third, right? Then the last bit that you need to say now is the issue of displacement. Butterfly fractures normally do not displace, they appear like that. So you can just put it and say there is no displacement. So I've spoken about which limb it is. I've said, as much as I started with I said I have a butterfly fracture. So I've spoken about the pattern. It's a butterfly fracture of the middle third. I've spoken about the location in the left femur, which limb it is. And then I can speak about displacement that is not displaced. So I've given this doctor all the information to decide what they are going to do with this fracture. But these fractures don't need to be operated. They can be immobilized, and then the patient will be fine. There's no displacement there. Let's take another example. Or maybe let me write it. So left femur, you can write left femur, middle third butterfly fracture. Undisplaced or non-displaced. You are done. This is your assessment. You are done. No one is going to ask you questions again. You have given them all they need. Let's take another fracture. Let's say now my fracture is like this. Still the middle third. So I would say left femur, middle third transverse fracture that is undisplaced, right? If this same fracture was going to be here, I would say left femur, proximal third transverse fracture undisplaced. Or if it was distal, you just change. Now let's say I have a fracture like this. Let's say now my fracture was like this. How would I describe this structure? It's still the left femur, it's still the middle third. So it's a transverse fracture of the middle third that is completely displaced. when you've got a fracture that is displaced, the chances of piercing the skin, the chances of piercing the nerves and the blood vessels become higher. So it's important to comment about displacement. If there is no displacement, you must say there is no displacement. If there is displacement, then you must say there is displacement. There are fractures that you don't really expect displacement, but it's just good practice to always put it down there that there is no displacement. So this fracture is a transverse fracture, and this fracture will need operation, because even if you can try to reduce, it's not stable. It can shift again. So this patient needs a pin inside there, depending on the orthopod what they want to do, but they need a nail inside there. So this is complete displacement, right? Which is like 100% displacement. If this fracture was like this, say it was like this now, still displaced, but it was like this. So this is where you talk about bony apposition now, because it's not completely displaced. It's displaced, but you need to comment about the apposition. Apposition is you look at how well or how poorly aligned are these bones, and you just use a rough estimation. It doesn't have to be 100%. Like in this case, I would say this patient has got so how I would describe, I would say left femur fracture, transverse fracture of the middle third of left femur, transverse fracture, middle third, that is displaced with plus minus 50% bony apposition. So if it's like this is well, the two fragments are in line. As much as there's a fracture, but the two fragments are aligned. But if you have something like this is about 90% bony apposition. Or you have got something like this is like 50%, and then it can drop to even 10%, where you've got something like this. So the opposing part, the only aligned is this part, is this portion here, is only, this is 100% bony apposition. But when you talk about complete displacement, it's when now you've got like zero bony apposition. That's a complete displaced fracture. So neurovascular examination becomes very, very, very crucial in fractures that are displaced. So what else do we need to talk about? Okay, let's say now we've got so it's just a matter of changing location, for instance, now if we've got a fracture in the left femur, and then this fracture was not a butterfly, now it was a segmented fracture, we would say that left femur, middle third, segmented fracture, that is undisplaced, simple as that. Or whatever, spiral fracture, we just use, what is important is to make sure that you use these for describing fractures. It should be in your memory, because for instance, it happens, it's so embarrassing sometimes that you describe a fracture to a colleague or to your senior or an orthopod, and then you forget this. They'll start asking you, oh, you say, doc, I've got a femur fracture, displaced fracture, or a femur fracture, a displaced fracture, committed fracture, whatever, and then you expect their response, and then they ask you which femur is it, just because you forgot to tell which femur. Is it the left, is it the right? Or you say left femur fracture, doc, because you cannot say, doc, I've got a left femur fracture, and keep quiet. Then they'll say, okay, I'm listening, I've got a left femur fracture. When you say I've got a left femur fracture, you're not speaking like a doctor. You're not going to get answers from them. They'll start asking you questions now, because they can see that you are struggling to describe a fracture. So you need to describe it. If you describe it like this, if they ask you after describing a fracture like this, paying attention to these 4 components or ways of describing a fracture completely, if they still ask you questions, it means that there are other things that they are thinking are important in a fracture that you're talking about. But this is well and good. Okay guys, on another video let's talk about the complications of long bone fractures. Thank you so much.